Hi, Dr. Amanatullah. How are you?
I'm amazing. Thanks again for having me.
Absolutely. Pleasure to have you always. Let's start with talking about revision surgery. Just at a high level, what is revision surgery?
Yeah, so revision surgery is basically a redo of a first time hip or knee replacement. It can happen for lots of different reasons in the knee and the hip, but really a revision basically is exactly as it's stated. It's a second go or even more than a second go at getting the joint replacement to work correctly.
We'll start with hip replacement revision surgery. Just talk a little bit about what would cause someone to need a revision surgery done to a hip piece and what you do when you go in there to revise it.
Yeah, so there's lots of ways that a hip replacement could fail. The good part is most of them don't fail. So kind of the aggregate data would say after a well done primary or first time hip replacement, 90 to 95% of them are in place or haven't been revised by about 20 years. So they do really, really well. What we're talking about now is that 10%. So in that, or 5%, in that percentage, the things that can cause hip replacements to fail are infection, um, dislocation, that the implants loosen up, or that wear debris or wear particles can cause the implants to slowly loosen up through inflammation. Additionally, other things might be a fracture or something that compromises the bone. Of those things, they all really get handled almost in the same way, except infection. So the reason infectious revisions are treated differently is because I have to get rid of the infection first before the hip can really be revised. If it's an infection, the infection basically dominates the treatment of that patient. So what we would do in that case is likely remove the implants, or we might do something called a irrigation and debridement and change the hip, the kind of the modular parts, the head and the liner. I know that all sounded really complicated, but the first thing to do is to get rid of the infection no matter what. After the infection's gone, the infection surgery gets treated the same as the rest. What we want to do at the end of the day is get stable implants. So if the implants are not stable because of fracture, or the implants are not stable because of wear debris, or the implants are not stable because of loosening, we remove the implant that's not stable and make it more stable. If the implants are fixed in place, meaning there could be a dislocation, but the implants are fixed in the bone, we may need to remove those implants from the bone. To do that, I might actually even need to make a fracture, break the bone to remove the implant safely. That sounds like a difficult thing. It's actually easier and more soft tissue, more friendly for the patient to break the bone than it is to compromise the tissues around the hip. So lots of things might happen in order to revise a hip, but what we want is stable implants that'll grow into the bone with a hip that doesn't dislocate and doesn't have an infection. That type of hip puts us in the best place to reduce pain and give people a functional leg after a hip replacement surgery.
Let's move on to knee replacement surgeries because I imagine they're a little bit different when you have to go in and revise a knee. Talk first a little bit about how they're different structurally, and then talk about what you do differently, the different issues that can occur in that particular joint.
Yeah, so knees are definitely different. What I would say about the difference is you can imagine a hip joint is actually a little bit simpler. It's basically a ball and a socket. So the goals in that surgery are simpler. I need to have implants fixed in the bone, and I need to have the hip, that ball and socket, to stay in place when you move through the hip range of motion. The knee is a little bit different. The knee is a complex joint. It's actually three joints: one joint on the inside of the knee, one joint on the outside of the knee, and one joint on the top of the knee where the kneecap runs over. And so I have to balance three joints to get that knee to work correctly. And so there's different ways that knee replacements fail. They also fail by infection, but in general, they don't dislocate like hips. They can be unstable or positioned incorrectly. They can also be subject to fracture or wear debris, just like hip replacements. So there are subtle nuances to getting this to work correctly, but it really gets into how you balance and how you get those three joints to work correctly. Additionally, how you get the implants out. So in infection, you treat it the same way. Basically, you have to treat the infection first. That could mean taking the implants out or changing the modular parts. But once those things have been handled, we treat all the knee revisions basically the same way. We remove the components that are positioned or loose, and we need to get them fixed in the bone. But there's no special fractures that we make around the knee. The knee can be subject to lots of bone loss when the implants come out because most knee replacements are cemented into position. And sometimes that cement can be even stronger than the bone. So the bone comes out instead of the cement. The good part is getting knees fixed into position isn't that complicated. And there's lots of new things that help us get the knee replacements fixed. We have things called cones. We have things called augments. What those do is they replace the bone with metal and let us put the knee in the perfect position so that we can revise that knee and get those three joints balanced correctly. There's big differences between knees and hips ultimately, but really most of that's on the surgeon's end. I have lots of patients who come back to me after a revised knee and they'll say it's better than when they originally got it, because it's really about getting it in the right position for that patient to have a stable, balanced knee, meaning that all those three joints are in the right spot, making the right compromises to get the good function out of that knee.
Excellently explained as always, Dr. Manatula. Thank you so much.
No worries. Thanks for having me again.